Welcome to Glass Half Full with Leslie Krongold. She shares her stories, experiences, and knowledge of living and coping with a chronic health condition. Learn about tools and resources and hear inspirational interviews that help you to live a life filled with quality and dignity. With 2 decades of support group leadership, Leslie's ready to help you make lemonade out of life's lemons. Are you ready?
Hello, listeners. We're nearing the end of February, which means it's almost International Rare Disease Day. I have a rare disease. Do you? There are over 6,000 rare diseases. I know I've met people with a disease so rare that they've never met anyone else with it. I can't even imagine what that would be like. Recently at my monthly support group, we had a family join us who had never met people outside of their family with myotonic dystrophy. If you're diagnosed and you live in or near a heavily populated city, you will hopefully not have to wait too long before you meet others with the disease. We have a patient advocacy organization that has an annual conference, and this conference has given me the opportunity to meet others with the condition who live throughout the U.S. and other parts of the world. We've had people at the conference come from New Zealand, South America, and of course, a few European countries. So, Rare Disease Day, celebrated on February 28th, is a day of advocacy. Getting out in the public to let others know about your disease. Last year, a group of us met at Senator Dianne Feinstein's office in San Francisco. This year, we're joining others with rare diseases at a local museum and park. So check the Glass Half Full website for links to learn more about Rare Disease Day. Maybe there's an event happening in your neck of the wood. And I will also include a couple links to podcasts that I did specifically about Rare Disease Day. Today, though, is not about rare disease. As I mentioned, I'm part of a patient advocacy organization which meets in person annually, usually in a different location throughout the country. And last year we met in Philadelphia. And one of the sessions I attended was titled Mindfulness as a Disease Management Strategy. Now, you can just imagine how that piqued my interest. Unfortunately, the session was less than 45 minutes, but I could tell the presenter had more to offer, so I introduced myself, gave her my podcast calling card. It's actually a postcard. If you want one, let me know. Anyhow, she and I recently had a chance to talk. Mary Holt is a busy woman. She works at 2 different Philadelphia clinics and has a private practice. In addition to her academic work, she's a registered nurse and has a master's degree in counseling. She has a lot of lived experience. Mary was a caregiver for her husband and experienced his loss at an early age with 2 young children to raise. She has also been in recovery from alcoholism for a number of years.
I have always worked in my nursing career with chronic pain and chronic illness. That had always been my path. And then there were actually a series of events that had happened personally in my life, and I had not been working for a time while I was pregnant with my second child. And was just knew I had to get back into the workforce. My husband had become quite ill, and I of course, he was not able to work, so I really had to kind of get back into the workforce, kind of help provide for us in a sense and my two children. So I saw this job posting that was for a nurse coordinator. I loved always being able to kind of have that integrative model. So I loved the coordination piece, and it was neurology. So it was the MDA ALS Center of Hope, and at that time it was at Direct University in Philadelphia, and that was back 2005. And then I started there as a nurse coordinator full time, and I was probably 7 years or so, and had a master's in counseling with a specialization in psychological trauma and bereavement. So working with people that had, a focus, of course, of chronic illness, terminal illness, that was really one of my passions. So when the mental health specialist left that center, then I kind of moved into that role in terms of being able to support the patients and the families. Yeah, all throughout the journey, really, from time of diagnosis or from the time that we, began with them, and then journeying for as long as they stayed with us, for a number of years. The rest of my time, my other full-time work, I actually do three things. So my other full-time work is working with Parkinson's, and I'm a nurse educator, a clinical educator with that population. So I work with people that have Parkinson's and their families, and I work with physicians, movement disorder specialists, and I do education. I teach the families and the patients how to use a particular medication, and injectable medicine for Parkinson's, and really how to live well, as best as they can with their Parkinson's. And then outside of that, I have a private practice in terms of life coaching, speaking, mindfulness practice, and things like that. So I've always had a desire to have, and my, goal still, one of my goals is to be able to do that more, to be able to reach people in a way that, to have a greater impact in terms of helping people. So when I was working originally with a neurology team, and during that time, I had a meditation practice of my own. I've been sober for a bit over 25 years, and I've had a meditation practice of my own for a number of years. And when I was at Jefferson, I was working with chronic pain patients, and they had a center for integrative medicine. So I went there and I took a mindfulness course, a mindfulness meditation. It was actually a stress management course. And at that time, I really impacted and shifted my whole experience in my own life, my professional work, my recovery, my own personal health in such dramatic ways that I went on for more training and really have been teaching and doing that practice and really focusing a ton of my work professionally around stress management, and how it relates to our health, and also how mindfulness can be a foundational piece of that in terms of helping people live well in the midst of chronic illness and terminal illness.
So what is psychological trauma?
When it's boiled down, it is trauma, if we look at just trauma in and of itself, is something, whether it be an experience, a situation, or an event that overwhelms the system, right? Overwhelm the system physically, of course. It could overwhelm the system, of course, which is my specialization, psychologically and mentally, emotionally, spiritually as well. So that can come from a certain particular event. It can also come from chronic exposure to certain things, whether they be, external or potentially internal. Somebody is chronically experiencing anything, negative, perceived as negative, to the point where it overwhelms our ability to kind of integrate our experiences on a healthy level for us to be able to function kind of day in and day out in a healthy way.
Yeah, because when I hear the term trauma, I think of people with PTSD or some sort of sexual abuse. I generally, and I'm not, a professional in psychological or mental health, but I think of it as like an incident or series of incidents that are traumatizing. But the way you've defined it, it sounds as if just the diagnosis of a progressive chronic illness can serve as trauma.
Absolutely. Yes, absolutely. I've experienced that with people. When we say in particular, when we, potentially give somebody the diagnosis of ALS or something, what can happen is that, I mean, on the flip side of this too, I don't know if we'll talk about it, but is also the amazing resiliency of the human spirit in terms of being able to, kind of integrate and wrap our brains around certain things and being able to function in the midst of these kind of crises that happen in our lives. But, when somebody is, faced with a situation that is in many ways, I'm going to say potentially, but in many ways alter their existence and how they perceive that, it can absolutely be traumatic. I was actually, just this weekend, I was working with our team, our multidisciplinary team, and in terms of and talking about the effects of, continually working with the population of, in neuromuscular conditions and neurodegenerative conditions, that, it is a traumatic environment because we're continually working with emotions that may arise from time to time, such as frustration, powerlessness, not being able to make an effect potentially, loss, grief, sadness, and that can be incredibly distressing to our mental capacity and our psychological capacity to be able to manage.
So, how do you define resilience?
So I would define resilience as the amazing capacity, which always seems to surprise me, the amazing capacity of the human being and the human spirit to be able to integrate and rise above what may be perceived as incredibly negative circumstances and find meaning, continue to move forward, continue to serve in some way. Not that all of these are necessary, but these are the things that I see in the people that I work with and the families that I work with. A tiny amount, like couldn't even fathom what it's like. Yet, you are serving the world, rising above, taking your experience and helping others. That is, to me, incredibly resilient because some people fold. I also see a lot of people fold. And I don't believe that there's a right or a wrong necessarily. We all do with the capacity that we have. But when you ask about resiliency, it's definitely, I think you're a living example of that.
So the session you led at the conference this year, How I Met You, was titled Mindfulness as a Disease Management Strategy. So I think we've led up to this, right? You talked about how mindfulness helped you and your training, and I'm assuming you've implemented it in all the work you do. Does a mindfulness training or does it as a strategy help build resilience?
For me personally, mindfulness is kind of a buzzword around healthcare, around the corporate world somewhat. And it really is a way of relating to the world. I practice mindfulness. Yes, there are strategies within mindfulness. And from the bigger scheme, it really is a way of relating to our life and our life experiences and ourselves and others. So it definitely can build resiliency because what mindfulness gives us is, number one, it gives us awareness. And the other thing I want to say is it's a practice. So it's something that is certainly cultivated over time. I am absolutely not an expert. It is something that I practice every day. every moment of my life that I can become more aware. So it gives us an awareness. So we're not just acting on autopilot. So we have some sense of, when we're going down the rabbit hole, per se. So it gives us awareness, and then it has this underpinning in terms of non-judgment and compassion. So it offers me the opportunity to meet my life and my life experiences, to, number one, become aware of my, how I'm perceiving something and how I'm relating to it. And then it gives me ways of coping with openness and non-judgment and compassion for self, for others, and for kind of life as a whole, which is simple in words, yet incredibly in life. So yes, it can 100%, build resiliency.
How do you do that in the clinic setting? I mean, I've been to the interdisciplinary clinics in San Francisco and at Stanford, for my disease. And I imagine they're kind of similar. And, I went for years. I haven't gone recently. But I had a PT who I saw, every year for many years. And one of the last times I saw her, and unfortunately she had to leave the clinic, she moved away. But she started talking about mindfulness meditation, and I was blown away because it was such a departure from anything she spoke about before. So I'm wondering, is it something that the other clinicians are talking about too, or is it just you?
That's actually, that's a great question. So it is, it just depends on everybody's level of comfortability. In our clinic right now, it's not something that everybody talks about. People, they are becoming more aware of it and more, I would say, open to it, whether that is because of, kind of what I do, what I talk about there. So I would love to see it one day as kind of a standard of care in terms of addressing and really offering people ways to manage, all of, you think, I'm just thinking about the physical therapist. So if the physical therapist is there talking about mindfulness meditation, that shows huge kind of integration to me. That says, there's a lot of integration there in terms of what can help support you, that she's not just addressing you linearly, right, with a solo focus. Acknowledging the fact that you are an integrated being, right? You have a mind, you have a body, and you have a heart. So how then can we, because they don't, none of them operate individually. So how is it then that we can take our healthcare management and also approach people? I really meet people in the sense that, that we each really do have the capacity within ourselves to kind of answer all the questions that we have, and we do have the resources within us, whether we need to find some more outside, but we really do have that within us. So I meet people hopefully with that intention that you really do have everything that you need. And my role with you is then just to help you uncover that and get clear. What's your relationship with yourself? That's a big thing. So when I'm seeing people in clinic, lots of our conversation is around what is the relationship with the illness. A lot of people are, they're angry, and those emotions sometimes are controlling them in ways that they are not even aware of, and impacting choices that they make, choices that they don't make, whether they're going to use their walker or not use their walker, whether they're going to accept a feeding tube or not accept a feeding tube. So how help them explore the reasons underneath that. Why is it that you don't want to use the walker when you've fallen 3 times, right? No, not in a fault-finding way, but just to help them explore that, it means that I'm, that much worse in my illness, or I'm giving into it, or what will people think of me? I'm weak, all sorts of things. So, so I really try to help them, to provide a space for that to arise, because the body does hold, there's a book called The Body Holds the Score, or Keeps the Score. And it really, our body is just like it needs to, all of these negative emotions, they all kind of, they can, whether we're giving a space for them or not, they need to come out some way, right? So especially people that have physical conditions, like you, all the people that I work with, I stress that it's even more so important, and myself, it is more so important if we already have a physical condition or a medical condition, that we, somehow manage the stressors and, negative emotions in our lives when they arise, because our body is already kind of working somewhat double time, to manage. And, negative emotions build up or not given space can just impact that in a profound way. There's a lot of research around that as well, in terms of the cascade of events with the, neurochemicals that kind of run through our body. So I hope to just meet people, I hope to just provide a space where people feel that they can, be real and really explore what they need to, so then they can make the best decisions that they can, for themselves. Whether it's using the walker or not using the walker, having the feeding tube or not having the feeding tube. So a lot of my work in the clinic is around life choices. All the choices we have to make. Yeah.
I invite you to check out Mary's website, especially if you live anywhere near Philadelphia. She teaches a variety of classes I wish I could take. Thanks for listening. I hope you're able to take away something you heard in today's podcast and apply it to your life. Take care of yourself, and I hope to see you online in our Facebook group, on YouTube, Instagram, or at the Glass Half Full website.
Thank you for listening to Glass Half Full. Leslie invites you to leave a rating and review on iTunes. This helps spread the word to others dealing with chronic health issues. For show notes, updates, and more, visit the website glasshalffull.online. Glasshalffull.online.